Welcome to ComSpark TV. We are live from Columbus, Ohio. My name is Jordin Kirk, and I will be your host today. Have the pleasure of sitting with Ms. Phyllis from the Ohio State Medical Center. And today we're just going to kind of talk through some of the things she's facing. I'd like to understand, first and foremost, how digitization is impacting what you're dealing with on a day-to-day basis.
Well, in healthcare, digitization really characterizes how do we bring healthcare digitally to our patients? How do we help them to experience healthcare in a digital way instead of such a manual way? I think, you can't schedule your hair appointment with one click on your phone. Why can't you get an appointment with the doctor just from your phone? There's a lot of risks and challenges in healthcare to that make that difficult. We have HIPAA, which is a rule about keeping patients' information private, and we are a highly regulated industry. But I think from an innovation perspective, our ability to move that forward and offer digitized healthcare to our patients where they can have a video visit if they have a condition that maybe they don't have to be seen in person. They can have a consult with a specialist that maybe is a state away and be able to talk to them about their condition when they're seeing their primary care physician. So you think about those things and why, we can do that in other industries, and we're all used to operating in a digital way. And so we need to transform healthcare so that it can really serve the patients digitally.
Yeah, I think that makes great sense. How do you feel, in your CIO role? How do you feel from a functions perspective? Like, what is the integral part of your role in helping make that come to life?
So I need to be both a champion for that and in helping to envision the future, what technology can bring to the delivery of healthcare, as well as at the Medical Center at Ohio State, we have a three-part mission. So we educate the healthcare leaders of tomorrow, and we also help to do research to really transform healthcare with groundbreaking discoveries of new cures and new treatments for all kinds of diseases. Also, a lot of discoveries about how to keep people from getting diseases, so really in that wellness space. And so we think about that, and we need to use technology and use innovation to be able to really transform that. And we have a lot of business needs, and I think that's the role of the CIO in today's companies, is to translate those business needs and what the business needs to do to our technologists and be that go-between between IT and the mission of the business. Make sure that that the business understands what technology can bring, and that the technologists in IT understand the mission of the business so they can be sure that they're delivering the very best thing and the very best next thing for healthcare.
Well, it sounds like you're off to a great start with it. Do you have a big project for the year or something that you're focused on here for the rest of 2019?
So a couple of things I would highlight, but one of the biggest ones we have for the year actually just went live over last weekend. Okay. We have a new system that has gone up at Ohio State University Wexner Medical Center, and it is a laboratory system. That sounds sort of like just a little departmental system that can kind of run in the background, except 100% of our patients get laboratory tests to help us diagnose them and to be able to provide them with the best treatment. And the complexity of this install from an IT perspective, we have interfaces from our systems to instruments that read blood. And so when you think about how we do those interfaces in such a way to be 100% correct, the benefits of this is they're allowing us to deliver even safer care. We're moving to an integrated system with all our other systems. We had a best-of-breed laboratory system before, and now it's really kind of in the same integration, the same database. And so some of the external interfaces we used to have just for patient identification are gone now. And our clinicians are able to use new tools to make sure they're double and triple checking identities of patients and the outcomes of tests, and being able to just make that link as tight as we can to ensure we're delivering the safest care for our patients. So that was just last weekend.
Okay.
So I guess it doesn't really count for the next year.
It counts for this year.
And I really think the next year, one of our biggest projects is to start to prepare for this realization of the Medical Center Strategic Plan. And that includes new facilities, a new hospital tower, as well as new ambulatory facilities that will allow us to really start to continue to spread the care that we provide to a larger and larger population of patients. We have a great demand for our services, and so part of our strategy is to build the services that our patients need and that are in short supply, and be able to really expand our footprint in Central Ohio. We also, if you think about the tools to expand our reach and to improve our patients' lives, it's that digital that I talked about, all those digital tools that become a virtual facility.
Absolutely.
That allow us to be able to provide care even when they're not there. So it's really expanding our ability to provide care for the population of Ohio and beyond, and to make sure that we're providing that through all venues, both digital but as well as physical.
Sounds like you have your hands full.
We sure do.
Well, thank you, Phyllis, for your time today. And for more information, you can visit comspark.tech.